Whether the patient is in a brace, a splint, or a cast, one of the things to remember is proper elevation. Elevation is to bring the part of the body that is injured above your heart level. That's not always easy to do, but it's the proper way to bring down swelling. Ice is good, but to really get the injured area above your heart will bring down swelling considerably. And once a patient is immobilized, a couple of things to remember that you may experience. Itching is one, and that's a hard thing to get rid of because we don't want any patient sticking anything down into the cast, because that can really bring about some issues that you don't want. One of them is infection. If you put something down your cast to scratch, you may nick the skin. The bacteria in that cast, after a few days, will find that small area and could infect it pretty badly. Keeping the cast dry is another thing that we want to do. Once a cast becomes wet, once the padding underneath the plaster or fiberglass becomes wet, it will stay wet, and it'll just stay on the skin wet, and it'll start to break the skin down, and you could get a pretty bad rash underneath the cast. So keeping the cast dry or the splint dry is important. And you can do that one of three ways. You can cover it with a bag, tape it, or many of these pharmacies that are out, one aisle medical aisle places, offer cast covers that are a thick plastic with a rubber end to it that goes right over the skin, and most often you can go right in the shower and take a shower with those cast covers. So it's important to keep the cast dry. As long as you pay attention to those elevation, keep the cast clean and dry, you shouldn't have any problems for the duration of wearing the cast or splint.